enter the room.
Hello, I'm Dr. Sana Zainab, GMC number 810627. May I proceed?
Oh, yes, please.
Hello, good morning.
Good morning, doctor.
I'm Dr. Sana Zainab, one of the FRTUs in the department. Can you please confirm your full name and age?
I'm Martin Johnson, and I'm 70 years.
May I call you Martin?
Yeah, that's all right.
All right. So, Martin, I believe that you are referred from the urology department. Am I right?
Um, yes. Actually, I have been experiencing this, terrible back pain, and it's been a while since I've been having this pain now.
All right. So, you are here for the back pain. So, for how long you have been having it?
About 6 months now, I would say.
All right. And did it start suddenly or gradually?
Yeah, I would say it was kind of gradual, but now it's unbearable, doctor.
Oh, okay. Are you taking anything to make it better?
I mean, they did give me a couple of medications. I'm
Mm-hmm.
taking paracetamol and ibuprofen. I take it
Mm-hmm.
like times, paracetamol and the ibuprofen I take it about 3 times. It doesn't seem to help much.
Okay, all right. And I will be trying to help you in that way as well. And anything that makes it worse?
I mean, everything makes it worse. Even if I have to
Mhm.
move a little bit, it just gets so bad. I'm basically bedbound at this point.
I'm so sorry to hear that you have to go through all of this, Martin. So, Martin, is the pain going anywhere else as well?
Yeah, it's mostly my back.
Okay, all right. And Martin, just to ask that sometimes when a person has severe back pain, they lose control of bladder or bowel as well. Is this the case with you as well?
No, doctor.
Okay, that's quite reassuring. So, Martin, from my notes, I came to know that you were diagnosed with prostate cancer. Am I right?
Oh, yeah, that's right, doctor. They informed me that, it's spread to my bones now.
All right. So, you are informed about this. And apart from this, how much do you know about your condition?
Well, I did, undergo, that chemotherapy and that radiation, but it didn't seem to help.
Okay. And how was your experience with those procedures?
Yeah, it was terrible, especially the chemo.
I can understand this. How are your symptoms of the cancer? Like any pain in urination and what else?
I have been experiencing the symptoms that, usually the problems with the urination, but now,
Mm-hmm.
now this back pain is what's actually concerning me the most.
Okay, all right. So, I just want to have a general overview of your health. So, apart from this, do you have any other medical conditions?
No, doctor.
Any medications you are on?
I mean, just the painkillers as of now. I mean, I'm done with my chemo.
All right. And any allergies?
Not that I know of.
Okay. And is there any family history of any similar cancers or back pain as well?
Well, my father had prostate cancer. Yeah, he
Oh,
died.
oh, I'm so sorry to hear about that.
Sorry.
So are you retired or do you work?
Oh, I'm retired. I'm
Okay.
a retired man.
And who else lives with you?
I have a loving wife at home.
Oh, that's great. And is your wife like supportive and takes care of you?
Yeah, absolutely.
Mm-hmm. And how are you managing your day-to-day activities? Are you managing yourself or you need some support?
I'm unable to carry out any activities, doctor. Like I mentioned, I'm basically bedbound at this point.
Okay, all right. So your wife helps you with that.
Yeah,
And are you financially sound?
yeah, we're pretty well off.
Okay. And do you smoke or drink?
No, doctor.
Mm-hmm. Okay, so you told me that your doctor has told you that your cancer has spread to the bones in the back. Am I right?
That's correct.
Okay. So is there any, by any chance, you have injured or any trauma to your back?
No, doctor.
Okay, all right. So thank you for answering all of my questions. Now I would like to record your observations. All right, that will include your blood pressure, heart rate, your temperature, and your breathing rate. And also I will be examining your back to look for anything, and I will be ordering your chest X-ray of the spine as well to see if any issue. Okay, so thank you so much for letting me examine you. So I have noticed that you have quite a pain in some of the parts of your back in the spine. So, as you already know from your previous visit to the doctor, that this has happened because your cancer has spread to the bones. Are you understanding this?
Yes, yes, doctor.
So as this is involving the bones,
2 minutes remaining.
So this is the major cause of the pain that you are experiencing. So in such a case, the painkiller sometimes do not seem to help at all. They help it initially, but when the pain starts getting worsening, it does not seem to help. So what we can do for you is that there is a special procedure for the patients who have pain due to the cancer thing. It is called radiotherapy. Are you
Okay.
following me?
All right. Okay.
Mm-hmm. So I suppose that the urology team has also referred you here because we are specialized department for doing this radiotherapy. We will be using radiations at your back, and that will be helping to relieve the pain in this case. All right.
But wait, can I get something for my pain right now?
Right now I will be giving you some morphine injections to make you feel better. All right. And after that, we will be booking your appointments for the radiotherapy sessions. Does that sound okay?
Yeah, yeah, that sounds good. Yeah.
Mm.
I'm
And
worried. I'm worried these medications might cause some drowsiness, and I have my daughter's wedding next week, and I was hoping I would, be able to attend that.
Okay, so we will be monitoring you in that regard. So I will be giving you morphine just today, and after that, I will be arranging your radiotherapy regular sessions. So that will not be any causing any thing, more drowsiness in that sense.
So will I
Mhm.
be able to attend my daughter's wedding?
So Martin, it is like that your condition is very critical, and I think anything, your health is the most superior thing which we should be prioritizing at this time. All right?
Move on to the next station.
Good job, Dr. Saram. But yes, it's very important to understand the underlying issue. So, what is the main issue in this case?
It was the back pain.
Exactly, that was a presenting symptom, sir. That is the main issue, right? So, this is mostly a counseling station, mainly because, this patient already knows of his diagnosis. You also know of the diagnosis. Now, how are you going to manage it? Explaining, counseling him of the diagnosis and how you can manage the pain. So radiation, definitely, that is the first line that you actually give for, metastasis to the back. But in a case where it is a metastatic cancer, you have to offer them morphine right away, right? And if he is actually
Hmm.
worried about, attending, because right now, there is nothing much that you can do, right? There is only so much that you can do to
Mhm.
help his condition. At this point, it's almost terminal. Right. And if there is
Mhm.
something that he needs to do, you need to support him in doing that. Like he wants to, he's very interested. He's actually come here because he wants to attend his daughter's wedding. Right. So you're trying to, make that happen for him. Right. So you're trying to make a treatment plan that can fit into this, expectations of his. So that is what he's expecting out of you. The reason he came for the surge, came to meet you is so that he can get something for the pain so that he can go attend his daughter's wedding. So is that an unreasonable ask, according to you?
Yeah.
I mean, because at this point, there is nothing that is that critical. It's not like if he attends a party, he'll just drop dead, right? So it's not that unreasonable an ask. what is actually preventing him from doing that is the unbearable pain, the excruciating pain, and that is something that we are going to be managing in this station. So that is the entire station of how you can manage the pain and facilitate him to attend his daughter's wedding. Right. So hence ice, always important ice. So at this point, if you're still confused, like what am I managing at this point? What is the management that I should give him? Because he knows he has cancer. He knows that it's spread to his bones. None of the medications are working. So what does he actually expect out of me? When you're starting with the management, and if you're still unclear about, what should be the treatment I need to give him, go for ice. Go for ice right away. Because you know the idea, you understand why he also understand why this is happening. So the idea aspect you got. Now what is the concern that he has, and what does he expect out of this consultation today? So when you're actually making a management plan, you need to have this at the back of your mind when you're making the management plan, right? Otherwise you're just left saying things, that I'm going to give you radiation, because he's actually gone through all that, right? Then why is he coming to the surgery at this point? Right? Because it's been 6 months since he has been suffering from the pain, and all of a sudden he's come, to the oncology department. Like, what is the purpose for that, right?
Mm-hmm.
So
Right.
you're confused, like, what do I do more for him at this point, right? So that's when you're actually confused on, like, I'm kind of stuck now. What management should I give him? He kind of knows everything. He's tried paracetamol. I'm going to just give him morphine and send him home. But am I missing out anything? If you ever have that doubt, go for ice. Ask about the concern, expectation. Like, what are you expecting from me today? Now, how can I support you in, what you for the purpose for your consultation today, right? So definitely that was an important aspect. But good job, Dr. Sana, right? Let's take a look at the performance. Dr. Mishi, were you able to mark?
Yes, I was.
Awesome. Yep, we have it here. All right, data gathering. Patient identifiers, confirm name and age. Good job. Use open-ended questions to elicit the main reason for today's visit. Explore back pain, right? Site, on-site character, radiation associated symptoms, timing is exacerbating and relieving factors and severity. Ask about red flags. That was good. You're trying to rule out any red flags, because at this point he doesn't have any red flags, so there is no reason for him not to attend the daughter's wedding, right? Because you've already done that. Right, it's metastasis to his back. Like, now is he having any, cauda equina like syndrome, right? Symptoms. So good job on doing that. Review past medical history, especially details of prostate cancer, diagnosis, staging, and treatment to date, right? Take a brief social history, living situation, support system, impact of symptoms on daily activities. Social history, assess the impact of pain on daily activities and social life. Perform a targeted examination, general physical examination, check vitals, examine the back for tenderness and range of movement and neurological signs in lower limbs, right? Partially covered. Check current medication dosage, effectiveness, and side effects. Experiencing any, explore any family history of prostate cancer. Yeah, I think I'll give you marks for that one. And what is missed? This was the main thing that was missed. This would have actually given you what to do next, right? So always in these kind of cases, definitely do not forget to ask ICE. Like, because at this point also you're actually wondering, like, what else do I do for him? He's kind of gone through the whole, charades of all the treatment, but, what else can I do to him? Why did he come to me in the surgery after 6 months of being diagnosed? I mean, of having this pain, right? So definitely ask that question whenever you're in that situation where you don't know why this patient has come to you today. Always ask him ICE. All right. So good job. Let's look at the management. Now, covered. Clearly explain that the back pain in the context of prostate cancer could indicate spread to the bones. Address specific concerns, tailor management plan to allow participation in the granddaughter's wedding. So this is something that I'm going to put missed on, because this was your task, right? You were trying to facilitate him to enjoy the last few wishes that he has, right? Discuss opioid analgesics such as morphine starting at a low dose with titration for effective pain control. Prescribe an anti-constipation regime alongside opioids to prevent side effects. Suggest adjuvant therapy for pain relief like NSAIDs if tolerated, bisphosphonates, targeted radiotherapy for focal pain, right? Reassure the patient the priority is symptom control and quality of life. Recommend MRI spine to assess the extent of metastasis and exclude cord compression. Arrange any blood test to assess, the status of the disease so far. Offer referral to palliative care for specialized symptom management and holistic support, right? Because at this point you understand that this patient has a non-responsive metastatic prostate cancer, right? So, and he is experiencing a lot of symptoms. So what is the next step, right? It's palliative care. It's not end of life. It's still palliative. It's support. How can you support them, right? Because at this point, curative treatment is not helping. So what is the next step, right? Suggest non-pharmacological measures such as gentle physiotherapy, occupation therapy inputs, use of mobility aids to maintain independence and reduce pain, right? You can offer that, we do have a couple of things that, can help you with your mobility. It might not be much, but it can help you do some minor tasks, right? Safety netting advice now towards the end when you're wrapping up the case. What are the things to, equip him before you send him off to a wedding? Safety netting, when to actually seek medical help, right? Advise urgent review. If new neurological symptoms appear, arrange follow-up in a few days to review pain control and side effects. Provide patient information leaflets on pain management and advanced cancer and safe use of opioids. Yep, there's a couple of things that you could have done for this case. That's all right. Interpersonal skills: empathy, acknowledge the patient's pain and emotional state, clear communication, use layman terms, and check for understanding. Encourage questions, pause frequently to allow the patient to ask questions. Professional boundaries, maintain professionalism while being approachable. Reassure, offer hope for improvement with proper adjustment. Discuss legal and ethical consideration, ensure he understands the confidentiality and consent. Okay, this probably may have come from another point, so I'm just going to be removing, but that's all right. I wouldn't penalize you much for that. I think I'll give you 2 or a 3 for interpersonal skills. So good job, Dr. Sana. Do you have any questions?
No, thank you. I haven't gone through this case before. This was my first time. So that's fine.
There's always a first sometime. So good job. I would say good job on the case. But always, whenever you are backed into a corner and you have no idea what you need to do, the best thing you can use is ice. Ice is the one rope that you can always pull on whenever you're, stuck in a hole. All right.
To practice this case with AI, please visit TuringMedSchool.com.